Now, here at News 3, we've reported on all kinds of testing during the COVID-19 pandemic. Well, scientists at Duke University have a test that can accurately find viral infections before symptoms show up.
News 3 reporter Zach Dahlheimer talked with Duke officials and a local doctor on this study.
I think it's one of those things, it's a game changer.
News 3 medical expert Dr. Ryan Light is reacting to a test at Duke Health in North Carolina.
I think it's coming around about the right time. It would be great to be able to test someone and test them positive for something prior to the symptoms showing up.
Duke officials tell us the blood-based test correctly predicts 9 different respiratory viral infections, including the flu and coronaviruses known to cause common colds.
What was unique about this study was for the first time we were able to show that we could utilize these biomarkers to identify individuals before they became sick.
Dr. Micah McLean is the primary author on the published study.
So we wanted to explore if we could identify some of these immune system signals in the blood of patients after they've been exposed to a virus, but before they feel sick, so that we can identify them at a very early time, much earlier than currently available tests. So we take a small sample of blood, and then we look in that blood and we identify what sort of genes are turned on and turned off in their white blood cells. And by the relative ratios of the types of genes that are turned on in their own white blood cells, we can identify what sort of infection is present.
While their study was conducted before the pandemic, McLean says they're testing to see its reaction to COVID-19.
We're hopeful that as we begin to study how well a test like this works in COVID-19, we can begin to find a niche for it as an adjunct diagnostic and support our national efforts with the current pandemic.
For Light, he believes this test could provide an extra tool for their playbook.
Hopefully we can use it in the future so that we can prevent the antibiotic resistance, as well as tell you what you actually have when you come into the doctor's office so that you know which virus you have and how to treat it.
Zach Dahlheimer, News 3.